Good morning, everyone. Welcome to our We Got This WA webinar series. Special thanks today to the Seattle Metropolitan Chamber of Commerce and to Business Health Trust for putting this webinar on. My name is Sarah Childs. I'm the Executive Director for the Business Health Trust and also get to work with the Chamber on their programming amongst COVID and other healthcare related topics. Today we're going to hear from ArchBright. So ArchBright is an amazing organization that provides HR resources to businesses. I highly recommend that everybody listening, everybody tuned in today, checks out ArchBright. It's a really great way to get expertise on HR topics when you don't have an HR department. So check them out, archbright.com. And Joy will be talking to us today about some of the leave practices that we all need to navigate in this new world and work from home. So a few webinar logistics before we get started. First, if you have technical questions or difficulties, please use the chat function. You can see that on your screen there. If you have questions for the speaker today, please use the Q&A button. This will allow us to track the questions and answer as many as possible. Joy will be talking through some frequently asked questions towards the end of her presentation, and then we will get to as many questions as we can for the presentation. And with that, I wanted to ask Joy to turn on her video and introduce herself. Hi, Joy. Nice to see you.
Thank you. Thank you for having me here.
Yes. So tell us a little bit about ArchBright. I'd love for everyone to hear a little bit about what ArchBright does and what you'll be talking about today.
All right. So at our core, we provide legal advice and HR advice and legal counsel, had that backwards. So we have spent the last few months doing our best to keep up with all of these new laws and provide resources to our members through our written resources and trainings, and then through our hotline we provide advice and counsel, like you said, to call that. And I would add to you said it's a great resource for those that don't have an HR department, but it's also a great resource to those that do, just because a lot of us have been HR departments of one, or maybe we do have an HR department, but it's great to have an HR professional or access to an attorney just to even bounce off those ideas. So we do take a lot of that too, of I think I know what to do, but but I want to kind of talk through this issue. So
especially right now when things are changing on, it seems like a daily basis. I know for myself, I felt like I could keep up a little bit more at the beginning, and now, there are lots more questions every day are coming up around what do I do with this, or how do I treat this leave, or all of those things. So thank you so much. I will turn it over to you, and I'll rejoin you at the end for some questions.
Okay, great. Well, I am going to share my screen. So I will do that. And hopefully everybody can see my blue screen now.
Yes, we can.
Move that on. Perfect. Okay. So today we're going to be talking about leave considerations during the COVID-19 pandemic. And I remember when we first started creating these resources and watched that, we were actually looking at making all of these, like our health outbreaks keynote and all of our resources more generic, because we said, oh, last year it was the measles and this year it's COVID, and next year it'll be something else. But this one has just been completely unprecedented. So so there are so many leave considerations to go through, and I'm just going to pick the main ones. Oh, sorry, there we go. All right, so these are the protected leave options that I want to highlight today. And then of course, when we get to the Q&A, I will do my best to answer whatever questions you have. But we're going to go through the FFCRA, the Families First Coronavirus Response Act. We're going to spend a little bit more time with that in the beginning. And then we'll bring in the FMLA, paid family and medical leave, the Washington Governor's High Risk Proclamation, and then of course the ADA. So we'll talk through each of those. And then when I go into the FAQs, I'll try to, kind of put up a question, and then we'll talk about what applies and how they might interact with each other. So the first one is the Families First Coronavirus Response Act. So this became effective April 1, 2020, and it's currently set to extend through December 31st of 2020. But whether cases improve or what happens next or how the next few months goes will really determine whether the FFCRA is extended into 2021. So it's designed to provide assistance to employees that are affected by COVID-19 specifically. And the components that we're going to spend some time on are the emergency paid sick leave and the emergency FMLA. Other are the tax credits. That's a little bit outside of our expertise at Archbright. So if you do have questions on those tax credits, I would recommend that you do talk to a tax advisor on that. And then of course the emergency unemployment insurance, which ESD runs. All right, so to be a covered employer, the FFCRA applies to employers with fewer than 500 employees, and that does take into consideration joint employment. So it includes all your full-time and part-time employees, employees out on leave, or temporary employees that are jointly employed. And so that definition of joint employment is under the FLSA. So the DOL says that employers should use the number of employees on the day the employee's leave would start, which means an employer should calculate its total head count each time an employee's leave is taken, if you can imagine that. So this presents a dilemma that an employer will dip above and below that 500 line, and I've even helped members who have actually experienced that. So think about it. Johnny seeks leave on a Monday when the employee has 505 employees. So he's out of luck. This law is not going to apply to him. But 1 week later, Susie requests leave at a time when the company dips to 499 employees. So she's in luck. She gets to take that leave. So at a minimum, it's going to create some awkward situations. And an employer really does have to calculate that each time the employee requests leave, if you're on that bubble. Of course, if you're safely below or above, you might not have that administrative burden. So workers that are independent contractors rather than employees are not considered employees. So if you do have that, you do not have to consider them. All right, so how much emergency paid sick leave? So the idea is to provide 2 weeks of pay. So it's based on the hours regularly scheduled to work. So the DOL makes clear that an employee is full-time if their employer normally schedules them to work for 40 or more hours per week. An employee who is not full-time is part-time if they work less than that. But the DOL doesn't actually distinguish between full and part-time employees. So the number of hours an employee normally works each week will affect the amount of pay. So for example, it's up to 80 hours, and 80 hours is the maximum that somebody can get. So if an employee regularly works 45 or say 50 hours per week, they could get that 50 hours in week 1, but then they only have 30 hours to take in week 2. So total of 80 hours completely. All right, so and under the FSCRA, there are 6 allowable reasons that the employee is unable to work or telework, and you'll kind of see through some of our FAQs that telework is important. The employee doesn't necessarily have to be able to work in the office, but if the employer offers that telework, that could exclude them from being able to take leave under here if they can perform that work from home. So the first 3 reasons, so under the first 3 reasons, the employee would be eligible to receive 100% of their regular rate up to $511 per day. So for most people, that would be full salary. So reasons 1, 2, and 3 relate to the employee. So the employee is subject to a quarantine or isolation order. And keep in mind that that could mean guidance from the CDC or the Washington Health Department or King County. So that's not necessarily a doctor that's quarantining them, but subject to a quarantine order. And that really does come into play a lot of times for employers that are navigating through this. The second one, the employee is advised by a healthcare provider to self-quarantine. And then the third reason, the employee is experiencing symptoms. So then the next 3 reasons are eligible for 2/3 the regular rate of pay up to $200 per day. So these relate to someone else. So the employee caring for somebody else. So the employee is caring for an individual, and that individual is an important distinction because it is not necessarily a family member. They're caring for an individual subject to or advised to quarantine or isolate, but they do have to be determined to be caring for that individual. It can't just be staying home with somebody necessarily, but actually determined to be caring for. And then the employee is caring for a son or daughter, and this one is not an individual, it is a true son or daughter whose school or place of care is closed or a child care provider is unavailable. So, and then the number 6 reason, the substantially similar condition as specified by the Secretary of Health and Human Services. We're 4 months later and we still don't really know what that means, but I think that was kind of designed to be this little kind of a catch-all in case that something came up that they couldn't predict, and so they wouldn't have to necessarily pass a new law. They could just say, oh, that's substantially similar. So just a guess there, but that's a little bit of a placeholder there that I don't think I've ever helped anybody with number 6. All right, so under the emergency family medical leave, there is just one reason, and this is an employee must be unable to work or telework because of a need to take care of a child if the child's school or place of childcare has been closed due to a public health emergency. So this provision simply adds another reason an employee can take FMLA. So it doesn't add an additional bank of FMLA, it adds another reason to take FMLA. And the definition of a child includes those under the age of 18, but I think it was probably about a week in after the rules were established that they added another FAQ that said, but if your child is over the age of 14, then you have to prove the need. Maybe there's a medical condition, a learning disability, any number of things, but you would have to prove that that someone would need to provide that care for a child that's over the age of 14. So nothing in the FFCRA grants the employer the right to question whether others are available to care for the child. It does make clear that only one person should be caring for the child, because arguably if someone else is available, then you don't need to be caring for the child, but there is no right to question that. So it is the employee saying, I need this leave, it is for the authorized reason, and it's pretty much approved. All right, so the first 80 hours of the EFMLA are unpaid, and the employees may substitute other leave options. They can substitute their own sick leave, PTO, or that 2 weeks of emergency paid sick leave during that 2 weeks. So it's important to note that employees don't have to take that emergency paid sick leave. They could actually say, I've got some PTO, I want to take that, or I want to take it unpaid, and then they could just simply take the remaining 10 weeks as paid. And really the reason that an employee might want to do that is because of exactly what we're up against now, is schools may not open, or they may open for remote learning. And so employees may want to save that time to be used at another time, or they might get sick, or they might have to care for somebody get sick. So an employee could choose to say, I want to hold that 80 hours. I don't want to use that for the first 2 weeks, but I want to take that EFMLA. So the remaining 10 weeks are paid at 2/3 of the employee's regular rate for the number of hours the employee would otherwise be scheduled to work, and the maximum payment of $200 per day and $10,000 total. So that's kind of the FFCRA overview, and we'll move into FMLA, the Federal Family and Medical Leave Act. And this will apply to those with 50 or more employees. That FFCRA may apply to employees that have less than that, but it's only going to give that one reason under the FMLA. The other reasons aren't going to open up and be available to them unless they're 50 or more employees. So up to 12 work weeks of unpaid leave in a 12-month period to care for, and I'm just highlighting the ones that might kind of interact with COVID, is to care for the employee's spouse, child, or parent who has a serious health condition, and a serious health condition that makes the employee unable to perform the essential function of the job. So if the employee has COVID-19 or is caring for someone who has COVID-19, FMLA is going to apply because we know that that has been determined to be a serious health condition. If the employee is high risk and can't work due to the employee's serious medical condition, it's likely because they have a serious health condition that makes the employee unable to perform the essential functions of the job. Maybe even if they don't have COVID-19, but if they do have a serious health condition that makes them unable to perform their job, FMLA could apply. FMLA and EFMLA under FSCRA, they are going to run concurrently because, as we discussed, EFMLA is just another reason to take FMLA. It doesn't add another bank of time. All right, so generally, Washington paid family and medical leave, generally up to 12 work weeks of paid leave in a 12-month period. So these, a couple of conditions that, a couple of the reasons that I'm highlighting here is to care for the employee's family member, and note that family member is different under FMLA and paid family and medical leave, much more expanded. Pretty much it does link with the Washington paid sick leave as well, that definition of family member. So a serious health condition that makes the employee unable to perform the essential functions of his or her job. So if an employee is sick with COVID, yes, Washington paid family and medical leave is going to apply. But caring for someone that is sick with COVID, probably, because they're caring for somebody with a serious health condition. But if they just have symptoms or they've been exposed to COVID-19, then probably not. So can FFCRA and Washington paid family and medical leave run concurrently? Highly unlikely for a couple of different reasons. First, because the employer is actually paying those wages, that would make them ineligible to receive that, and it's not considered a supplemental benefit plan. They may not even be eligible for paid family and medical leave, depending on the reason for the leave. But the employee, if they are sick or caring for somebody they're sick, they may choose to take paid family leave instead of FFCRA, and then still keep that FFCRA available at a later time. And then also in the DOL FAQs, it specifically states that FFCRA cannot be taken at the same time as a state-sponsored disability plan, which likely the paid family leave would be considered. So the two would not, they could be used one or the other, so they could stack. So it could extend the amount of time an employee is out on leave, but they couldn't be used at the same time. Okay, so the high-risk proclamation. So this proclamation was originally set to expire in June, and then about mid-June, the governor extended it to August 1st. And then a couple days before August 1st, it has now been extended to the date in which the state of emergency is removed. So who knows when that is going to be? I would expect that it will go into maybe towards the end of the year, but again, we have no idea what the cases are going to look like or how this will play out over the next couple of months. But this proclamation is one to pay attention to until the governor removes that state of emergency. So Washington State takes the definition of who is high risk from the CDC. So that is determined to be older adults, age 65 and older, and then people of any age with underlying medical conditions. So there is two buckets that are identified in the CDC, and one is those that are considered at risk, and then you have a second bucket that those that might be at an increased risk. The ones that are at increased risk essentially just get to walk in and tell you, I am at risk and I can't work. You cannot verify their medical condition. Now, on one hand, that's great because we want those people to be protected, and they probably maybe won't already be in the office. Maybe they're already out on leave because they are at risk. And so maybe it's not that verification that was in that last proclamation extension. Maybe that verification isn't causing a lot of problems. But the jaded HR person in me, knows that there are some employees out there that really do deserve it, and then there's those employees out there that may be taking advantage of this, and it is a little bit difficult for those employers when you can't verify that medical condition in order to give them leave right now. So if an employee is in that high-risk area, one of those high-risk medical conditions, they do not have to verify. But then there's that second bucket of those that might be at an increased risk, and those you can ask for verification. So if you're an ArchBright member, we have a request form that we suggest that you use that simply allows the employee to certify, I do have this health condition, or I have a health condition. You're not really asking them to define which one. It's just, I have this health condition, I need leave, and sign it. Maybe appealing to their conscience a little bit, that when you have to sign your name to something, you might actually think about it a little bit more. So, but again, we want to be sensitive to those that do have these medical conditions and really do need to be careful right now. And then those that are older, adults age 65 and older, you have their date of birth as an employer, and so that does qualify. But keep in mind, under the Washington High Risk Proclamation, you do not have to proactively reach out to anybody. So if you know of somebody that has one of these medical conditions, or you know of somebody that's age 65 or older, you do not have to reach out to them. You simply have to accommodate them if they seek accommodation from you. Okay, so under protected, the last protected leave option I'm going to go through is the Americans with Disabilities Act. And the protections under ADA may include those that are high risk that we just talked about, or those that have a medical condition that may prevent them from wearing a mask or a face covering. So that's one of my FAQs in a little bit, so I'm not going to spoil that. But the ADA requires what's called the interactive process, which basically requires both employer and employee to engage in a discussion regarding what options could be considered to allow the employee to perform the essential functions of their job. So it's very important that employers document these discussions, as well as what accommodations they've tried, what's worked, what hasn't worked, so that then they can consider other accommodations, or they can determine that possibly leave is the next step in an accommodation, because under the ADA, a leave of absence may be considered a leave of absence may be considered a reasonable accommodation. Okay. So FAQs, I'm sorry if I was kind of going a little bit quick through that. Whoops, I want to kind of get through that and then go into these FAQs that hopefully you all have these same questions that we can talk through, which of the leave options that we've talked about would apply to each question. Okay, so what if an employee has symptoms of COVID-19? And it's important, this is symptoms of COVID-19. We're not saying that we know the person has COVID-19. Are they eligible for leave? So they may or may not be sick with a serious health condition, but we know they can't work. So what are they eligible for? So FFCRA, yes, this clearly fits in one of the first three eligible factors to take up to 80 hours of FFCRA at 100% of their wages, up to that $511. Under FMLA, we don't really have enough information because right now they have symptoms, but we don't know if it's a serious health condition. So maybe, maybe not. Under paid family leave, very similar to FMLA, we don't know yet if it's a serious health condition. And the ADA, possibly. So again, famous HR and legal answer, it depends, maybe, probably. So under the ADA, we would go through that process to determine whether they need an accommodation. But we do know that this one does fall into the FFCRA for sure. All right, so what happens if an employee tests positive for COVID-19? Are they eligible for leave? Well, we know that not all individuals that test positive are actually sick. In fact, that's actually part of the struggle with this disease right now, right? That employees may actually have COVID-19, but they don't have any symptoms. So they may or may not be sick, but we know they can't work if they test positive. So they're likely to be eligible for leave under FFCRA. Yep, this one's clear. FMLA, even if they're not sick, we know that COVID-19 is likely to be considered a serious health condition, so probably FMLA does apply. And then paid family leave, yes, COVID-19 would likely be considered a serious health condition. So again, you can't take FFCRA or paid family leave at the same time, but they could choose whichever one. And there are some guidelines from the CDC that say that you can return to work 10 days from the time an employee tests positive for COVID-19, or a 14-day quarantine period if you've been exposed. And there's kind of some confusion around that because it's kind of interesting that those timeframes are different, but apparently from scientists that are way smarter than me in this area, that if an employee is actually tested positive, then 10 days later they are not considered to be contagious. So maybe for that employee that hasn't been sick but still tested positive, it's a 10-day quarantine period. All right, so what if an employee is afraid to return to work? Are they eligible for a leave? So FFCRA, not on the surface. We don't quite have enough information to know what they're afraid of, but not necessarily FFCRA at this time. The FMLA, it's not likely a serious health condition, but again, we don't have quite enough information. Paid family and medical leave, same as FMLA. ADA, maybe. So ADA, that governor's high-risk proclamation, employers must engage in that interactive process to determine what the reason is. So if an employee comes to you and they say, I'm just afraid to come to work, we need to find out more. So we need to understand the reasons why to determine the next steps. Are they high risk? Are they just afraid? Do they have a high-risk individual at home? What are their fears? And then we can address that. Maybe we can address it through an accommodation. We can move a workstation. We can create a staggered shift. There's a lot of accommodations that you should consider as an employer, but we need to find out some more information to determine next steps there. All right, so what if an employee cannot wear a face covering due to a medical reason? So are they eligible for leave? So maybe employers must engage in the interactive process under the ADA. So it's important to know that not wearing a mask may not be the reasonable accommodation unless you can allow an employee to work alone. So working alone is defined as like you're working alone in a cab or a car or a tractor or something like that, in a four-walled office or in a cubicle that I think it's a four-walled cubicle that is 6 feet. And then you have to take into consideration those sit-stand desks that may be there. So if an employee is determined to be working alone, then they can remove the face covering when they are working alone. But L&I has made clear that if an employee cannot wear a mask and no accommodation can be made, leave is the next option. And this one has created a lot of confusion because we have this issue of, well, the governor's order says wear a face covering except those that have a medical reason for doing so. But if you have a medical reason for doing so, that's where it creates that ADA interactive process to determine what accommodations can be made, but it doesn't mean that the mask would just simply not be worn around other people. So make sure you exhaust all possible accommodations before offering a leave of absence. I've worked with some members that are moving employees into a private office or something like that where they can still accommodate the person to work and not wear that mask or wear that mask significantly less. So what if an employee just simply refuses to wear a mask? And so we first need to determine if there's a medical reason. So it goes back to that ADA, maybe the high-risk proclamation, exhaust any protected leave options if available. But ultimately, if an employee just simply refuses just because they don't like them, well, who does? But if they don't want to wear a mask, they don't like wearing a mask, if they refuse to wear that and there's no ADA-related reason, you could offer them a leave of absence, but ultimately that leave would not be protected. So this is one where we need to exhaust that because we want to make sure that there is no underlying reason for that refusal. But refusal to wear a mask would likely be subject to discipline, just like any other refusal to wear a PPE, refusal to wear safety glasses, or refuse to wear steel-toed shoes, or you name it, the PPE. Handle your discipline process in the same way with someone that refuses to wear a mask. Right, so what if I require them to self-quarantine because they've traveled or attended a large gathering? This one is coming up a lot. We are seeing some employees that are saying, I've been cooped up for this long, I want to go on vacation, or they might be attending a large gathering. And if they're eligible for leave, and they can't work from, they could be eligible for leave if they can't work from home. If you have a workplace where you can say an employee that travels or attends a large gathering would quarantine for 14 days when they return, then it may not be as much of an impact on your company to say you work from home, and that's fine. But at a high level, it seems there are no protected leave options that fit, but the health department specifically states that an employee that attends a large gathering where physical distancing and mask requirements are not followed by everyone should consider themselves exposed. So this creates that possible reason under the FFCRA, because that health department or a public health official has now said you should quarantine. It's no longer just a personal reason for traveling or for attending that, and those protections under the FFCRA could possibly kick in. Do I have to maintain health benefits while the employee is on leave? So under FFCRA, yes, under the emergency paid sick leave because it's only 80 hours. And yes, under the EFMLA because it's another reason to take FMLA, which includes that benefits protection. Under the FMLA, we know that there's a requirement to maintain health benefits at the same rate and benefit as if they were currently working. Paid family leave, it depends, another famous answer. So under the paid family and medical leave, health benefits must only be maintained if required under the federal FMLA. But ESD released guidance effective June 14th that interprets this to mean that FMLA and paid family and medical leave must overlap for even just one day, and then the employer must maintain health benefits for the entire length of the paid family and medical leave. So if they're not eligible for or not taking FMLA during paid family and medical leave, then there's no requirement to maintain those health benefits. But again, if you weren't aware of that change, June 14th, that ESD made, and they flip-flopped on that. In December, they said that was the rule. And then in January, they got so much feedback from employers that said, that's a burden to employers. And so they removed that. And then in June, they put that back on there. So watch for that overlap of FMLA and paid family leave. And under the ADA, it depends on the amount of leave in the health insurance contract, and employers must engage in that interactive process. Also, under the high-risk proclamation, that order does specifically say that health insurance must be maintained for those high-risk individuals taking leave under that proclamation. Okay, what notice do employers have to provide employees regarding leave options? So under the FFCRA, employer must provide notice as soon as practicable. Under the EFMLA, an employer must provide reasonable notice under the emergency paid sick leave. Who knows what that means, but if they're going out and they're working with you, then pretty much immediately as soon as you know. The FMLA, the notice of eligibility within 5 days. The paid family and medical leave, you have a statement of employee rights that needs to go out within 5 days. And the ADA has no specific notice requirements, but just the requirement to engage in that interactive process. So now I kind of open it up for some questions from you. And I am not sure if I can see the Q&A box. Nope, I am not good enough. So I'm just going to stop sharing and keep my video on so I can then answer some questions here.
So lots of questions. That was really helpful to sort through. So maybe starting back at the FFCRA, and that's Families First Coronavirus Responsiveness Act. Is that the correct acronym?
Right, yes.
So that provides for up to 80 hours or 2 weeks at their regular, whatever they're scheduled. Talk to us about how or if this can be used in multiple instances. For example, they need to quarantine awaiting results, and then 3 months later they get COVID, and also would have another qualifying event?
Yeah, great question. So the 80 hours is total. So if they exhaust that 80 hours today, they don't have it again for the rest of the year. Now, again, we don't know if it's going to extend into 2021 and maybe there'll be an extra bank there. We don't know, but right now it is 80 hours. So that is a reason why employees might want to be careful about maybe using some paid sick leave or using PTO or saving that if they don't need it. But if they use that, if they need to quarantine now, it is a separate bank. So even if it is a different qualifying reason, that bank is not available. It's a one-time.
Okay. And so talking a little bit about self-quarantine, tell me if this is a correct understanding. I'm also trying to regurgitate for my own learning. So you're eligible, or an employee might be eligible for the FFCRA leave, that up to 80 hours, if they need to self-quarantine due to an order of a healthcare provider or a public agency, for example, like CDC. So in that, does an employee say, like, if they were exposed to someone who may have COVID, does that qualify as something that has been said by the, a public health agency?
Yeah, so this is one that we were unsure about, but as more information has been released, it's become clear that the CDC or the Department of Health could be that public health official. So if they have published guidance that says you must quarantine for 14 days and the individual has been exposed, then that applies. That is guidance that the employer must consider. So it doesn't just have to be somebody that has gone to a healthcare provider or, been designated by that the CDC could be that guidance.
So in that example, if I go to a family gathering and that next Monday, my mother, who I just, saw, she thinks she has COVID, she doesn't have a positive test, would that then qualify me to take FFCRA leave?
Good. So it could be if you are seeking medical diagnosis. So if you you have been exposed to somebody who has symptoms, or you have symptoms, or it's a little bit of a gray area. We need to kind of find out the facts. But if you think you have, it falls into that presumptive cases, which is, we're kind of kicking that around a lot now, is that if you think you have COVID or you have COVID, and any of us could potentially have it, right? We don't know because, of that, the people that aren't sick. So I do think there does need to be some reason for believing that. But if it's a person that's been exposed to a person that's been exposed, that's pretty low risk, and that's not really going to qualify you in there. So the person that you're exposed to either has to have symptoms of COVID or reason to believe that they have it to be considered exposed. So some employers are kind of erring on the side of caution and saying, well, I can have you work from home, or I can do it. And if you can do that, great. If you can't do that, then, we need to ask more questions.
And under the FFCRA leave, this up to 80 hours that we're talking about, that is paid at 100% of their wages, up to $511 a week?
Under that 80 hours, yes.
Yes, just for those 80 hours. Yes. And it's the emergency FMLA that has that first 2 weeks as unpaid. Is that
correct? And then just to clarify on the 80 hours, it's split into the two sections. So 1 through 3, reasons 1 through 3 is 100% pay up to 511, and then reasons 4, 5, and 6 are reasons, again, separated into something's happening to me is reasons 1, 2, 3, and then something is happening that I'm helping somebody else with, I'm caring for someone else is reasons 4, 5, and we don't know what 6 is, but reasons 4 and 5, and then that is the 2/3 pay.
Okay, that makes sense. If we're thinking about FMLA in general, and now we have emergency FMLA, that really is just expanding what you were saying. The first 3 reasons are happening to me, second are happening. So it's kind of expanding who can take FMLA. So those same kind of.
Well, in the FMLA, the only reason it expands, the only emergency FMLA reason is that childcare reason. So that's the only one under there. The emergency paid sick leave has those 6 reasons. The emergency
paid sick leave. Sorry.
So the emergency FMLA is just added that one extra reason.
Okay. Could you readdress the size requirements for, particularly like an employer who's under 50? What are they required to do under kind of the various leaves that you were talking about?
Right. So an employer that is under 500 employees, this applies to both the emergency paid sick leave and the emergency paid family leave. But if you're under 50 employees, then the only reason somebody could take FMLA is for the child care. The child care reason. So it doesn't expand FMLA in general to those under 50. All the rest of the provisions are still 50 and more, but if you're under 50, then you would extend that 10 weeks of unpaid EFMLA for the reason of the child care, the closure of the school or the child care center. There is a possible exemption for employers that have less than 50 employees, but it says that, and I'm like making sure that I'm reading it the right way, that the possible exemption is essentially if you, I thought that I could read it to tell you the exact, but now I'm not finding it. Essentially, it has to cause you to go out of business, is really the gist of it. So if it is not just a hardship, there is no undue hardship provision in there like ADA. So essentially, if you're under 50 and you say, if I pay out this money, I am literally not going to be able to survive as a business, then you just need to document that very, very clearly and carefully and maintain that. And it says you don't turn anything in, you just document the reasons why you believe that you're exempt from that. So I would be really, really cautious and work with legal counsel on that before that you would to do that. But if you're over 50, all provisions of FMLA. So you could end up with an employee that's already taken FMLA. Say they had a baby earlier in the year, or they took leave at a surgery to care for somebody. They may not be eligible for that EFMLA because they've already exhausted FMLA.
Okay. And are there any sort of size differentials for the FFCRA or for the expanded paid sick leave?
No, not for that one. That one is just, it's the same, less than 500 employees.
Okay.
So if you're less than 500 employees, then you have to do this.
Okay. So that 50 really is talking about the emergency FMLA piece.
Right. And really because it's the difference between regular FMLA and EFMLA. And that's really the only reason it comes into play.
So talking about large gatherings a little bit, you might not know the answer to this, but what is considered a large gathering that might trigger somebody into that quarantine need?
So, great question. I have no idea. But really, what the Department of Health is saying is that a large gathering is, I think right now it's anybody more than 5 people outside your household because we're in I think most of us are in phase 2. So it'd be anybody more than 5 people outside your household. But in general, what it is it's any event where you're at where social distancing, and I actually hate the word social distancing, so I'm going to use physical distancing.
Physical distancing.
Because, so I'm not a fan of social distancing. We need to be social. So when physical distancing cannot be maintained, that's 6 feet, and everyone's not wearing masks. So if everyone's wearing masks and everyone's maintaining 6 feet, you're not in the definition of being exposed. So I suppose you could go to a large gathering, and if everyone around you is wearing masks, then you're maintaining your distance within, or with your household members. You wouldn't meet the definition of exposed. So that's where if you're going on an airplane or public transportation, that's going to be tough because likely you're going to get inside that 6 feet window, even if you are wearing masks.
Mm-hmm. Yeah, and I think this is a great area for people to kind of refer to the Governor's Safe Start Plan too, of kind of what's required under each phase depending on your county, because it does talk about gatherings, but then there's weddings and funerals and spirituals, many layers. That's I'm just going to say that's a sticky one. I'm not
It
loving
really
that.
is.
Sorting through
Yes.
that.
And it really is. And that's why, that physical distancing is so important. I think most of us have gotten used to the masks by now, but at the same part, we've been cooped up and we want to go places, or, we need to go to an event or something like that. But keeping your distance and wearing a mask, you technically would not hit the definition of exposed. So you just still have to be a little bit careful there.
Yeah.
And that's where, having ArchBright or any legal counsel or something to visit with that and work through all those questions would be helpful.
Let's see, another question. Can you prohibit an employee with an increased risk coming to work, specifically those who can't work remotely due to their job duties and have to go on, leave if they're not working in the office?
So if this is a person that hasn't come to you and says, I want an accommodation, then no, you can't prohibit them from working because the law is specific that says you don't proactively reach out to them. So if I'm understanding the question correctly, but if the employee has said to you that they have a high risk and they need an accommodation, then you have a duty to explore all of those accommodations. Because in general, if everyone's wearing masks and everyone's staying 6 feet apart, and you can, guarantee is a strong word, but you can monitor that to the point where you feel comfortable, hopefully that high risk person might feel comfortable too. But that's where you get into that, what are they doing? What's their job? Are they working alone? Do they come in a separate door? Can they, what is the interaction with other people to determine what that risk is? And if they can work from home, then they should, because they're high risk and we want to keep them safe. But at the same point, if they can't, then we want to explore all of those options before we move to leave, especially if they want to work. Because they could come to you and just say, I simply want leave because it's just too big of a risk. But if they come to you and they want an accommodation, then you have a duty to consider everything. So it depends. Another, the it depends answer, right?
Yeah. So talking a little bit more about experiencing symptoms. So if an employee is experiencing symptoms and they used regular PTO, for example, and indicated this, would it be covered under the emergency FMLA if they seek treatment for COVID? Is that correct?
So yes, if they're seeking treatment, they have symptoms and they're seeking treatment, it would be covered under the FFCRA. But I think you said that they were using their own PTO. And that is, and actually a paid sick leave is not one that I put in there, but could have, and maybe
Right.
should have, right? But it is an authorized sick leave reason because somebody has symptoms. So if they're using PTO, they don't necessarily have to request leave under FFCRA because they could just choose to take their paid sick leave instead because it is an authorized reason. But either one is going to apply there.
And for like an FFCRA notice, I think you mentioned that ArchBright has developed a leave request form.
Right.
I imagine, is that in your toolkit?
Yes, that is in our toolkit. And actually all, even non-members can access our COVID resources page. So if you go out to the ArchBright website, I think at the top of the screen, it says COVID resources. And you do have to give us your name and email address, but that's it. That's all you got to give us. And then you can access that. So even members would just be directed to log in, and you don't have to give us any other information. But if you're a non-member, you can still access that, and we've made all of those available. So that's also available on that page.
Super helpful.
One thing I will say about the form, just because I didn't get to it yesterday, is that I did notice that the IRS has released some information about what they consider to be appropriate documentation, and it's not as strong as what FFCRA says. So our form is following the FFCRA guidelines that says you must provide, the doctor's statement or the quarantine order, or even just like a screenshot from the CDC, like you have to provide something. But I did notice yesterday that the IRS, thanks to one of our members actually, the IRS has actually just said that you just have to provide the doctor's name. and phone number. So interesting, that kind of answers maybe one of our questions of, you give this leave and it's important to employers to get the tax credits, and that's how they're paying for this, and especially to small businesses, that's critical. And we really don't know what the audit process is going to be for those tax credits. So maybe that's kind of some proof that, they just need to make sure it is legitimate, but they're not requiring that level of detail that we may have thought under the FFCRA. So just know that the request forms are there, and again, we want that employee to sign off and to certify, I need this leave. And then just know the documentation, just watch the FFCRA and the IRS to make sure that you have that documentation for the tax credit.
Okay, that's a really helpful call out. Talking a little bit about masks. So do you need to require a doctor's note for employees that are indicating that they have a condition that they cannot wear a mask and they're requesting accommodation?
So if they fall under that high risk proclamation, then you can't, that first bucket of underlying medical conditions, then you can ask for verification. But again, the accommodation is not just not wearing a mask. So you can explore through that interactive process that maybe you don't ask for verification they have that, but you certainly can kick around what accommodations you can provide in order for them to not wear that mask. Or we helped a member through a situation where an employee could wear a mask for like 2 minutes an hour, or it was really actually interesting because they had determined that a really, really short time. So we have to look at it and say, well, is that reasonable? Do they work in an office and they only have to get up for 2 minutes and wear that mask? Is that reasonable? Maybe, maybe not. We have to look at everything on a case-by-case basis. So, but I would just caution if they're in that first bucket. If they're in the second bucket or maybe something else, then you can get that doctor involved and you can ask for that medical verification.
Okay. Can an employee take both FFCRA and paid family medical leave at the same time?
So that one is likely no. First, because it is wages that the employee is paying, and it is not a supplemental, it's not a PTO, it's not a paid sick leave that you've designated as supplemental. So you're paying them wages. And then also it's paid family and medical leave is a state-sponsored disability plan. Likely, we think it would be determined that, and the FFCRA specifically says you cannot take that at the same time. So no, but, of course, we can dig into that more if, we get some details that might, maybe they could take, they could stack them, they could take them intermittently potentially, so it is kind of maybe a stop-start thing there, but not necessarily paid at the same time.
Yeah, and I know I sound a little like a commercial, but using the hotline that you guys have is really helpful, I think, for these type of situations to be able to talk through. I know we've done that on various levels for BHT and for the chamber, and just talking through things that are coming up is very helpful to talk through those specific facts and circumstances, and to not have to just try and dig through the internet and find your best guess.
Definitely. And if we don't know the answer, we will research it. So that's another kind of, plus of our hotline. Is like, well, if we don't know the answer, we want to know the answer because somebody else has the question too. So, we'll dig into it and figure it out with you.
And so talking more about Washington's paid family leave, if an employee has a non-COVID related, serious medical condition like shingles, for example, and he or she cannot work, after they exhaust their sick leave with their employer, can they be applying for coverage under paid family medical leave?
Yeah, they could. Yeah. If it's determined, that would require, and when you're applying for paid family leave, that's completely, the decision to accept leave is completely up to ESD. But if you provide that documentation from your doctor and you cannot work, then it could.
And what is the requirement to continue health insurance coverage under Washington paid family leave, Washington State?
So this is that crazy law, and it is crazy. So I just can't even sugarcoat that, because this is where if FMLA and paid family leave overlap by even just 1 day, then you have the requirement. So if you're an employer that's under 50 and FMLA doesn't apply to you, then the healthcare that that requirement to maintain health benefits is not there. You don't have to maintain those, in which case the employee, it would be subject to your benefits contract, whether you can maintain those for a certain amount of time during leave, or if you give them COBRA notification. If the employee is eligible for FMLA and takes it, and FMLA and paid family leave overlap for even just one day, then the employee is entitled to that maintenance of health benefits for the entire duration of the leave.
Got it. That's complicated, but that you simplified it. You laid it out.
Good.
How are related parties treated under these? So a parent company that has 20 employees, for example, and then a subsidiary company that might have 115 for some of these laws. Are you looking at them together or each individual entity?
So it's based on the definition of a joint employer. So most of the time they're going to be considered together if they have common ownership. And there's a whole joint employer rule that would apply to that. So that would be one that we'd want to dig in a little separately and find out, do they have common ownership? Are they have operational involvement in both businesses? And if they do, then they likely would apply. And similarly with that, an agency, if you have an employee that is part of an agency, but they are performing work for you and you control their work, then they would be considered a joint employer. So again, it depends, but it depends on that, the definition of joint employer.
That's helpful. Well, we have reached the end of our scheduled time. There's a few more questions, so we will try and stick around and answer these ones. But I did want to let folks know, I just put in the chat panel as well, for those that are part of Business Health Trust, we do have a partnership with Archbright, and so BHT members can get access to a lot of the resources that you've been talking about, as well as explore how to get access to more things like unlimited hotline and even legal advice and counsel. So if you're a BHT member, please reach out to us if you need help accessing those, and we will try and get through the rest of these questions, but thank you everybody for joining us today. And Joy, if you have a few more minutes, I think there's 4 more questions that I'll just go through.
Okay.
So company has 10 employees. One was diagnosed with COVID and works 32 hours a week and has been out for about a month now. So how do they calculate how much they need to pay him or kind of what their obligation is?
So the employee is working 32 hours a week now consistently, so they're missing 8.
Yeah. I think I'm reading it as his normal work hours is 32 hours a week. And he's off right now due to COVID.
Okay. So it's based on it's based on the number of hours that you're normally scheduled to work. So you would base the eligibility based on 32 hours.
Okay. And so that this individual would be eligible for FFCRA for 2 weeks. And then
correct.
The pay, what was the second one?
The emergency paid sick leave, and then the emergency family and medical leave, the emergency FMLA.
Okay.
That one would also be 10 weeks of pay, with the first 2 being unpaid or paid sick leave used, and then 10 weeks at their normal rate of pay, because they would be considered that part-time employee.
Okay, great. So if an employee has a COVID symptom, public health is recommending that they contact their healthcare provider to be tested and stay, out for 10 days from symptom, or 24 hours without fever. So many things. What is the process for this employer? Do they notify people that they're eligible for FFCRA, or do they wait for them to ask and let them determine how many they want to use and such out of the 80 hours?
Okay, so you have to, you do have to notify them that it's eligible for them, but you should also have that poster up. So if you know that they have been exposed, then you should be offering it to them, that as soon as practicable thing, whatever that means. So as soon as you know, you should be offering it to them. But if you don't know, then you don't you don't have an obligation to, to seek that out, but you should have notified everybody through posting the poster.
Okay. And if someone is not eligible for FMLA, do employers have to continue health insurance coverage if they're approved for Washington paid family leave?
Not if they are not eligible for FMLA.
Okay.
So, yep.
And when we're talking about seeking treatment for some of the qualified leaves, what if people do not seek treatment? So they say, I have symptoms, but they're not seeking treatment.
Right. So the FAQs on the Department of Labor's website specifically say that if you are not seeking treatment, you are not eligible for the FFCRA. The practical HR person in me says, how do we really know? Mm-hmm. But that's a different issue. But technically, if they just like, oh, I think I have some symptoms, but I'm not seeking treatment, they're not eligible. But if they've been exposed, then, and they know they've been exposed, then they might fit into number 1 instead of number 2, or I might have those backwards. But number 1 is that, they've been, by a public health official has notified them. So they might fit into that if they've been exposed. But if they're just having symptoms, they haven't been exposed, and they don't seek treatment, technically that's not protected. Could possibly be under Washington paid sick leave. They could take their own sick leave, but not FFCRA.
Okay. That's very helpful. And just a reminder that this webinar will be available on the Seattle Metro Chamber event page later today or tomorrow. And Lee will also be sending out a post-event email as well. We will probably include a link to ArchBright, to that COVID-19 resources page, as well as a link to this webinar. Well, Joy, thank you very much for talking through a lot of these questions and scenarios. I know, employers of all sizes are really, there's so much being thrown at them. So this is a really helpful resource. We really appreciate your time.
Great. Thank you.
Thank you. Have a great day.